So here we have to study about three cattle diseases. The first one is the anthrax. Because in case of anthrax, it is causing disease to both the human beings as well as animals. Now, if you take anthrax, it is a bacterial disease, and that bacterial disease is caused by a bacteria known by the name Bacillus anthrax. Once upon a time, it's a very important disease, even for animals, even for human beings. So nowadays, anthrax is somewhat controlled because we have antibiotics against it, and using antibiotics, we will be able to control this anthrax to a large extent. So here I will show you some images of how anthrax is creating problem for both human beings as well as animals. So this is the bacteria which is causing. So this is how the symptoms of anthrax is happening. See here you can see that. These are some of the symptoms which are creating problem in human beings. Now anthrax is not a very serious problem in human beings, but most of the time it is now controlled. Now I will also show anthrax in cattle. So here you can see that now because there are large number of cattle, the anthrax is still a major problem in many areas of the world. So here you can see that how anthrax can be affecting cattle. Here also there are different pictures are there. So anthrax can cause a lot of death in the case of cattle. So that is one. So it is caused by bacteria, and bacteria is known by the name Bacillus anthracis. Here you can see that. Now coming to how it is being transmitted, mainly by contaminated soil, water or feed. If this bacteria known by the name Bacillus anthracis is present in water or in soil or in the feed, it can spread through that process. So that is how the contamination or spreading of this anthrax is taking place. Then entry through skin wounds. Earlier I showed you how the wounds are created by anthrax. Then flies and other vectors. So sometimes house flies or other types of flies can sit on the body of cattle, and through that also there is spreading of anthrax. So this is regarding the spreading of anthrax. Then what are the major symptoms of anthrax? One is sudden death, often the first and only sign. Only when the cattle is dying, the people will realize that it has some problem. So only during the examination only it will be we will be able to understand what is the reason for this sudden death. So it is one. Then high fever. So in most of the time people may not be checking unless we have one or two cattle, cow, people may not be knowing whether the cow has any problem, even only when it is not feeding properly. Then staggering or difficulty in breathing. So that is also a problem. Then blood discharge from nose, mouth or anus. All these are symptoms showing that the cow or cattle has some major disease. Then absence of rigor mortis. So normally after the death of an animal or human being, after few hours the muscle become very rigid. For example, if you are sometimes you have observed in dead body, the hands are like this at the time of death, it will be like that. So after that, after 5 or 10 hours, we cannot open it. The muscles will be in a state of permanent contraction. If the hands are like this, it will remain like that. We cannot bring it to this level. So that relaxation will not take place. So that is normally what is called stiffness or rigor mortis after the death. But in case of anthrax, there may not be any such thing. It may be because of some interference with the calcium metabolism. Then rapid decomposition of the carcass. Carcass means dead body. So after in the case of anthrax, there is sudden, very fast decay. There is a normal process of decay. Instead of the normal time, there will be faster decomposition. Then how we are actually diagnosing the disease? One is through microscopic examination. We will be checking whether this bacteria is present or not. So that is one way. Then DNA testing, then culture and PCR testing using DNA. Then do not perform post-mortem without biosafety due to zoonotic risk. Zoonotic risk means spreading of disease from cow to human being. So anthrax can create problem both for cattle as well as human being. So when we are, for example, if veterinary surgeons are doing this post-mortem of the cow, to find out the reason, they have to take proper safety measures. Otherwise, this can cause a disease risk. Then how we can treat the disease? One is at the early stage, high dose of penicillin or oxytetracycline. These are the antibiotics which are used. However, treatment is rarely possible due to sudden death. So that is because here you can see that the first and the only symptom is sudden death. So unless we know that there is a possibility of anthrax affecting the cow, and we are not giving precautionary treatment, then we may not be aware that the cow had a problem called anthrax. So this is the treatment is rarely possible due to sudden death. So vaccination with the stern is for vaccine in endemic areas. So that is this one way by which we can control. Then proper disposal of infected carcass. So from that there is always possibility of spreading. Avoid disturbing non-anthrax burial. For example, if you have buried any cow in a soil, do not open it for several months. So that is what avoid disturbing non-anthrax burial because the bacteria can be there for a longer time. I think this anthrax is many times used as a biological weapon. In case of there is a one island somewhere in around UK. I will tell the name of that. See, there was an island in the UK. It's an interesting. This is see, it was an island off the coast of Scotland, and during the time of World War II, the scientists and British military used anthrax spore. Now, what happens is that uh, even now we may not be able to enter this island. The spores of this anthrax is still in this island, which the name of the island is Burinard Island. Because in 1990 efforts were made to but still people are not going to this island. So the problem is that once these spores of anthrax are there in an island, it will be there. So that is the one major problem in dealing with this anthrax. So there are such famous cases are there. So there is always possibility of zoonotic disease. So this is regarding the first disease by the name anthrax. Most important thing is about the name of the bacteria and how it is spreading by soil, water or feed. Then about the symptom, sudden death is the major symptom. Then treatment is using penicillin. Now the second is when prevention is mostly using vaccination. Vaccination is the best possible method for prevention. Now another is foot and mouth disease. Sometimes you might have heard that. This is a highly contagious disease caused by foot and mouth virus. And the virus is FMDV pi coronavirus and different variants of pi coronavirus. I will show you the pictures of this foot and mouth disease. See, this is how it is affecting. See, you can see that all the pictures may not be very comfortable in seeing. So this is the foot and mouth. See here, it is causing or wounds on the mouth. That is why it is known as a foot and mouth disease. See here also you can see some of the pictures. So here also the lesions may be there. See here also that lesions may be there. So this is how the foot and mouth disease is creating problem to the cow, and the main virus is pi coronavirus. And foot and mouth virus, foot and mouth disease virus. There are two viruses. One is foot and mouth disease virus, and second virus is known by the name pi coronavirus. Different variants are there. Now, how it is being transmitted? One is direct contact with the infected animal. Then aerosol means air drops, for example from nose, mouth, etc. Then any kind of contaminated equipment, clothing, etc. Then saliva, milk, urine, fecal, feces, and blister fluid. Here you can see that some lesions or will be wounds may be there. All these can spread disease. So any kind of liquid or air particle which are coming out from the disease from the infected animal can cause disease. Then what are the major symptoms? One is fever will be there. Just as in the case of anthrax, there will be high fever. Then blister means small balloon-like or bubble-like, the blisters in mouth, tongue, gums, etc. Then excessive salivation. The cow may be producing too much saliva. That is one. Lameness, not able to move much, lame. The animal may remain very inactive. Then a drop in milk production. This is another indication that loss of weight or abortion in pregnant animals. So then young animals may be dying due to myocarditis, means a kind of heart attack like situation, myocarditis. So these are some of the major symptoms which are affecting the animal. Then coming to disease diagnosis, most of the time we have to go for ELISA or viral. Then antibody tests are there. So you will be taking blood from the animal and we will be checking that. So this is now foot and mouth disease is you might have sometimes heard that. Anthrax is not a common disease. But in case of foot and mouth disease, it is very common. This is only problem affecting cow recently in our area. Then treatment, there are three types of, for example, if it is a bacterial disease, we can treat the animal using antibiotic. But if it is a viral disease, there is no known treatment, only supportive treatment are there. So virus cannot be controlled by any medicine. So we are just giving the supportive care like antiseptic, painkillers, then antibiotic, sometimes to prevent any kind of bacterial infection. That is a secondary infection. So these are the methods which are there, and for that there should be vaccination. Like corona, we are taking vaccine. Then strict quarantine and biosecurity measures. For example, there is always possibility of infection spreading from one animal to another animal. Then movement control in disinfection, and culling during large hours. For example, if a lot of cows are there, killing the animal. Sometimes you might have heard we have to kill a lot of animals to prevent the spread of disease. Then notifiable disease must report to the veterinary authority. So if too many cattle in one area are having this disease, sometimes we have to kill all those cattle. That is the only way by which we can control this disease. Then another is rinderpest. It is an eradicated disease. rinderpest and caused by also a viral disease. Now this has been completely eliminated. There is no non-cause of rinderpest. I will show you rinderpest. See, this is also a bacterial disease. Now this disease has been completely eliminated from the world. So there is no, it was only, previously only this disease was present. See here you can see this is one of the most dreaded animal disease known by the name rinderpest, also known by the name cattle plague. So caused by morbilli virus. That is the name of the virus caused by rinderpest virus. Now here you can see that mainly direct transmission with the infected animal through water, feed, etc. Then whatever part saliva, fecal matter, all that coming from the animal can cause the rinderpest. See here also you can see what are the major symptoms. One is fever will be there, 40 to 42 degrees centigrade. Then depression, the animal may not be eating anything, cow may not be eating, no loss of appetite. Then erosive lesions from the mouth, gums, tongues, etc. From all these regions there will be injuries. Profuse blood, there is diarrhea will be there filled with blood, that is one symptom. Dehydration, another symptom. So in case of this disease, high mortality, 90% of the cow will be dying. So that is what nowadays it is completely eradicated. There is no trace of rinderpest. So here also you can see that the same way. One is we can go for ELISA or PCR. Then clinical sign, necropsy. Zebra's typing of intestinal mucosa, and the intestine, if you examine in the intestine during a postmortem, we can find certain stripes will be there, just like zebra, like a pattern will be there. So that is the one method for diagnosis. There are no treatment, only supportive care is there. Because 90% of animals are dying if they have this disease. So the vaccination, name of the vaccine is a plovrite vaccine. Now this disease is now known, then quarantine, then declared eradicated in 2011. Second disease eradicated after the smallpox. So smallpox is now a completely eradicated disease, and this is the second known disease which has been eradicated from the world. So because now this virus may not be present anywhere. So that is why it is now called as an eradicated disease. So it is known as the cattle plague or rinderpest. So here you can see a comparison. There are three known cases. Anthrax is caused by Bacillus anthracis. In case of anthrax, we can have antibiotic treatment. Whereas foot and mouth disease, FMD virus and picorona. So here you can see that mouth blisters and lameness are the main symptom. Rinderpest is caused by rinderpest virus and morbilli virus. And here you can see this, it has been eradicated. So presently the only major disease is the foot and mouth disease out of these three different type of virus. So this is an idea regarding different type of diseases.